So it's going to give us just like till 1:45. But
Okay.
if we need more time, I'll just set up another meeting.
Sounds good. Sounds
and,
good.
and just email
Are
it
you
to you.
recording it?
Yes, I'm recording it. I I'm recording it on a what's called Audacity, and I can put it on a podcast. And now
Oh, cool.
and I'm recording it video wise on WebEx, although I'm not as familiar with that.
Hmm.
I mean, we'd kind of started out like you just called in, and if you're comfortable with things are we're at, or you want to ask me anything before we get really into the meat of it, then go ahead.
I'm expecting you're guiding me through this. Okay,
Yes.
just so you know.
That I think just with the questions and then what you brought and then the things we have to talk about, we'll be fine. So,
Excellent.
and I have all because I already saw your recent thing in the webinar, then I have some familiarity with it. So, if Joe, if you're okay, then we'll just go ahead and get started.
Yeah, let's get started.
Okay. Well, welcome then, Joe Cautilli. You are a very experienced man. In did you start out as a psychologist?
Actually, I started out as a counselor,
Uh huh.
and I started at Temple University. I got my start as a counseling psychology. That's my first master's degree.
Uh huh.
At the time, I was in my master's program. I had latched on to the local behaviorist who was there at Temple University, and that was David Reynolds.
Mm-hmm.
And he was sort of my mentor when I was in my master's program in counseling. I did some work with him. Alan Ivy had developed, Alan Ivy was a humanistic counselor,
Mm-hmm.
and he had developed this. He did what he called his behavioral excursion.
Mm-hmm.
He developed a thing called micro skills training
Hmm.
for counselors. And micro skills training became a very popular way of training counselors where you would break the counseling skills. You did a task analysis of counseling and you broke the counseling skills into micro skills and then you trained them. Well, when I was with David Reynolds, one of the things we were spending a lot of time talking about was making that into a class. And Temple actually had used classes like that in the past where they would go through each of the discrete counseling skills, such as reflective listening, such as paraphrasing, active listening techniques, and they would use them in this model and then have counselors do that. We would videotape it and then we would actually play it back. And then I went to Temple's after that. So that was like 88, 89, 90. I went into Temple's 91 ish. I went into Temple's applied behavior analysis program through special education. I concentrated and focused on applied behavior analysis. Now, I had many years in the field up until that point. Um, and then after that, I moved to, well, it was. After that, I moved into Temple's school psychology program and got my doctorate in school psychology. And that was in 2005. I licensed as a psychologist a few years later. Well, my first license was in counseling. My second was as a psychologist. I helped the counselors in Pennsylvania get the counseling license.
Mm-hmm.
Um, then a few years later, I moved into my postdoctoral master's program at Fairleigh Dickinson University, and I did a postdoctoral master's in clinical psychopharmacology. And then that was the end of my academic career. So I did the postdoctoral master's in clinical psychopharmacology probably around 2010, 2011.
Mm-hmm. It's somewhat similar for me, not as extensive, but I started work at a psychiatric hospital and I knew nothing
Mhm.
about behavior analysis. I went to a Brian Iwata conference,
Mm.
and it was all about the functions. And I thought, well, this is really, right up our alley. This is what it wasn't really well, it was kind of a seen as a formality to go to that, but I thought that was really essential for the kinds of problems that we were having in the hospital is to, and
Mhm.
what you said also about breaking things down to smaller task analyses. I just thought it was exactly what was needed. That's how I got where I'm working on today. So,
Excellent. So see, we have some tie-ins together there.
yeah, I mean it's some similarities there, but you had written about an editorial about schizophrenia in 2007.
Mhm.
And it was following up on the. If I'll just speak of it briefly, it's about, well, why haven't, in general, why haven't behavior analysis been used more for the problems like schizophrenia, and what can you tell us about that?
Well, if you look at behavior analysis, in some ways, schizophrenia has become like our forgotten promise.
Hmm.
We had gotten early on the behaviorists like Gordon Paul were all involved with units for schizophrenia. Matter of fact, if you look at the first draft of evidence-based practices that were put out by Division 12 in the American Psychological Association, the clinical division, I might have the division number wrong, I'm getting older now, but if you look at it, one of the things you'll see there's token economies for schizophrenia. And so that was the initial rush of behavior analysts in the schizophrenia. When I was in graduate school, a coworker, a co-student of mine, Julia Griesta, had written a book with Alan Belak and Kim User on social skills training for schizophrenia, which was actually very popular at the time. Now, social skills training for schizophrenia has a small effect size, small to moderate, depending on which study you look at. But even things with like a small effect size in meta-analysis, if you take them out across an entire system, can have a large impact. For example, Bigland had pointed this out that if you do the meta-analysis, for example, on health behavior, and if a doctor just says to a person, you should quit smoking if they smoke, there's a 5% chance they quit,
Hmm.
which is a very small chance. But if every doctor in the country did that for every patient that smoked,
Uh-huh.
you have massive effect on the system. And so these were some of the kind of things that I think people had missed about behavior analysis. It wasn't going to be the only intervention that's used. But in the 90s, when I was a much more avid goer of conferences, and I was at AABT back then, which was the Association for Advancement of Behavior Therapy, which later became the Association of Cognitive and Behavior Therapy, Cognitive and Behavioral Therapies. When I was at there, one of the big things all the behaviorists were interested in, this is back in the 90s, was this concept of um, punishment density and how escaping punishment led to schizophrenic relapse. And so people with schizophrenia having relapse, sorry, old person, old language
Uh-huh.
comes out every so often. But so the idea there is that the home would become punishing, and they had a concept that started out as negative expressed emotionality, then they just started calling it expressed emotionality, but it was this idea of punishment density. So there was a behavior family therapy model that was built on communication training, problem solving, and the use of token economy systems, which actually proved to be extremely beneficial, either alone or in conjunction with medication, in preventing schizophrenia hospitalization.
Hmm.
Right. And this was a real interesting point here. The idea of this concept of that the home gets too punishing, the person with schizophrenia wants to escape, they wind up at the hospital.
Hmm.
Right. That maybe if we could lower the punishment density, some of the negative expressed emotionality, the parent yelling and screaming, what Patterson used to refer to with conduct disorder kids as nattering behavior,
Hmm.
which was just not effective punishment techniques, but really just aversives. Um, and if we could actually lower that and increase the rate of positive reinforcement for the person, a lot of what we see as behavioral problems with schizophrenia lower to the point where the family is not as burdened, they're less likely to take the person to the hospital, lower the point for where the person with schizophrenia was, so that they could then not have to run and escape to the hospital.
Hmm.
And you could actually produce a better system. Now, the interesting thing about behavioral family therapy is it actually has a really good evidence base. It has a really good Fallon, Falloon. Falloon, I think that was one of the names associated with it.
Hmm.
Um, Lieberman was also very big in the area, but he was also with social skills training for schizophrenia. He did a lot of stuff on being assertive with your doctor and being able to tell them when you had medication side effects and those kinds of things.
Hmm.
But if you look, this was actually a very evidence-based, this behavioral family therapy model was a very evidence-based practice for not just treating schizophrenia, but medication is very good for the positive symptoms of schizophrenia, the things we see,
Hmm.
the behavioral excesses that we see too much of, the negative, the voices in the head kind of thing. But it does not do a good job at all on what's called the negative symptoms of schizophrenia or the deficits, the lack of motivation, the failure to clean oneself, the failure to clean house. And that actually turns out to be a bigger long term predictor of long term outcome with schizophrenia, with people with schizophrenia. And so back in 2007, there was an article written that was sort of like, okay, well, behavior analysis has been kind of locked out. And I wanted to go through and basically say, well, we've had areas of success.
Hmm.
If we could work through as a team with some of these areas, I think that that this will be a very, very good area for behavior analysis to kind of go back to its original promise, which if you remember and I forget who did the study, but might have been Holt Mazarin, where they were showing that you can take a vegetative person with schizophrenia and get them to basically move more using reinforcement programs, which then led into token economies. And you had Gordon Paul's program, which was one of the original biopsychosocial programs for schizophrenia. You had Kaffner and Saslow, who did their behavior analysis and functional analysis for mental health problems and looked at more of a broader based kind of functional analysis. You had a really substantial model by which to move into the mental health field in general. And I think that over the course of my career, one of the things I've always been looking at is because, as I said, my background was in mental health counseling, my background was in school psychology. It's always been where have the behaviors been, and why aren't we there anymore? Now, a lot of what's happened is in the early 2000s, the chasing the money phenomena occurred,
Hmm.
which is I know because I was teaching. I had a behavior analysis program in criminal justice that I had developed
Hmm.
at St. Joe's University. This was the on-campus program, and we were training people in behavior analysis to use with offenders and people in prison. Now, what happened was, though, at the time, is there were many people in the field of behavior analysis who were saying autism's where it's at. Autism is where the field is. Some of them were the same people that said developmental disabilities is where the field is. Let's all go to developmental disabilities. So they didn't really change. They might have refined their population to even be a smaller one, but they didn't really change their position. They just picked a subdivision actually of some of developmental disabilities. And so what happened is the field went like gangbusters because a lot of the stuff had come out in '87 on Lobos' study on the effectiveness of behavior analysis when you go with very young kids and you do early intervention. He was able to show that there was roughly a 40% to 60% recovery rate. It's actually even mentioned in if you look, it's actually even mentioned in an episode of Quincy where Quincy has an autistic child there and he's working with them and he says that maybe he wants to get him into like a Lobos program, and he says maybe it's
Really?
just he likes the field. So yeah, so there's this old episode of Quincy, which sparks this interest in the public. Catherine Maurice did her book on Let Me Hear Your Voice, which kind of popularized this whole idea of behavior analysis with autism. But behavior analysts from all other areas started to dwindle
Uh-huh.
and in some ways were diminished in the field. And I think we've lost a lot when that occurred. I think that at the time I was leading the push. I was the editor and then the co-editor and then the associate editor for the journal, The Behavior Analyst Today,
Mm-hmm.
which was a journal that I had founded back then. And we were writing heavy gangbuster editorials on licensing of behavior analysts, thinking we would come in more broad-based.
Right.
And we did when we did the licensing in Pennsylvania. We came up with a behavior specialist license. Pennsylvania behavior analysts still have the broadest range of practice in the entire country, but they license as a behavior specialist here, not as a behavior analyst. A lot of the behavior analytic programs were tied to the licenses to autism bills, which Laura Unum wanted to do, and that actually was very effective, and that was very helpful, and she was very bright in doing that.
Uh-huh.
But it's really focused in on narrowing the field, and I think that has been. Look, when I got into behavior analysis, there were very few of us, and we went everywhere. We
Uh-huh.
did everything.
Uh-huh.
Right now, there are very many of us, and I talked to some BCBAs who have gotten their degrees from maybe online programs or programs that were just a 4-course training course in behavior analysis. And I feel like I'm checking off, Skinner and about behaviorism had this myths of behaviorism.
Mm-hmm.
And I feel like I'm checking off the myths as they talk, like, oh my God, do
Huh?
people really believe this? It's like almost like some of the people became stereotypes of behavior analysis rather than behavior analysts.
Uh-huh.
With everything you hear, like behavior analysis doesn't address feelings. And I get shocked when I hear these things. It's like maybe I'm just too old and it's time to retire. You know what I'm saying?
Oh, well,
But
I'm going to put a link in for the show Quincy in case anyone is not aware of what the show is if they listen to this. But
it was Jack Klutman,
yeah.
Quincy M.E.
Yeah, it was a great show. But it is, I mean, a lot of this, what we talk about with the focus, it comes from the Medicaid mandates to treat autism. I mean, we talked about following the money. That's where it came from, that they were able to get this, and that kind of made the industry into something for autism. But it has nothing to do with whether behaviorism is effective for one diagnosis or another.
No, you're right with that. And actually, medication has come into other areas that have pushed behavior analysts out. We talked a little bit about schizophrenia. Well, the medications for schizophrenia, and I speak of this as someone that's fairly up to date on that literature because I did a postdoctoral master's in clinical pharmacology. The medications for schizophrenia have not, in general, been much better over the last 30 years. We've gone from first generation antipsychotics to second generation antipsychotics because they said, okay, that these are safer, you don't get the extrapyramidal effects, but then you develop metabolic disorder and they start growing breasts and they start gaining weight and they start having cholesterol problems and hypertension. And people with schizophrenia, on average, die in the United States about 15 years earlier than people who do not have schizophrenia. So there's a real social justice issue there. But the medication came in, people said, okay, this stops the hallucinations, this stops these positive symptoms of hallucinations and delusions. And so that's going to be our standard of care. And everything else got faded to the side. And that's not so good. And that's happened also with children with ADHD. There were early studies that showed that methylphenidate worked real well with ADHD. There was the MTA collaborative that found out that the combined methylphenidate worked real well with worked superior to behavior therapy. But that study had two problems. One is on core symptoms, they called it. One is they defined the core symptoms as everything that the medication did.
Mhm.
So it wasn't a core symptom, any of these other problems. It was just what the medication actually attacked. So they kind of rigged the study from set one. And there are people that do that. They bait their studies. The second thing that MTA did, and I kind of forgot it for a minute, so now I have to come back to it. The second thing they did is if you go back to the initial study, they faded out the behavior therapy program as they should have done, but then they did their evaluation 6 months to 9 months after the behavior therapy program was faded out.
Mhm.
So now you have medication active compared to faded behavior therapy. So why don't you just compare it to faded medication? Well, everybody says, well, you know that medication doesn't work when they're not taking it. But the behavior therapy was generalized, and they had a study that showed they got fairly good maintenance on the behavior therapy program, but still an active treatment better than a generalized treatment
Mhm.
in those respects. The other thing is you found out even with the kids with ADHD, medication doesn't do much when it comes to the symptoms that are not in the core diagnosis, like the oppositionality that you may develop. And so behavior analysis had a good foot into this. Even Russell Barkley, if you read his book on self-control, he adopts the rule-govern model, which is kind of a hybrid model from Skinner's verbal behavior and the early work that Steve Hayes was doing on pliance and tracking. Before Steve Hayes went all into the relational frame stuff, he was doing the counters. So you had tax, and then the counter for the tack was pliance, and then you had the man, and the counter, the listener behavior to the man was tracking. Um, reverse that. I think I just said that in reverse. But so what he was doing was, and they grabbed the old work on self-control. If you remember Don Beer, he did this idea of when Don Beer was working with children with impulsivity, he did what was called correspondence training. And there's two types of correspondence. There's see-say correspondence. There's do-say,
Mhm.
and then there's say-do correspondence. If you think of it as a learning channel and then an action. So he actually had the do-say correspondence, which do-say is you do something and then somebody stops you and asks you what you did and you're able to say it, and then you place a reinforcer on that. And then the other was the say do correspondence,
Mhm.
which is you said you were going to do something and then you did it. And then they gave you the reinforcer for having done what you said you were going to do.
Mhm.
Well, the correspondence training went into self control training programs.
Mhm.
Now, self control training programs, you could see the influence. I'm trying to remember his name. Begins with a P. I think it's Paglia. He did the self control training for ADHD kids, where they would sit, they would put out the person next to them would write the rating of the kid's behavior on a 1 to 5 scale, 1 to 10 scale, and then the kid would write their own rating of their behavior on a 1 to 10 scale. They would both then flip it over. If their ratings matched, the kid would get 2 bonus points. If their ratings didn't match but were within one of each other, they would get the higher of the two ratings. And if there were more than 2 points apart, they would get no points for it. So
Mhm.
the idea was this was increasing correspondence between what they said and what they did. The idea of building rule governed behavior.
Mhm.
And then they would move into uh, Watson. A lot of people don't realize Watson was very heavy into problem solving. He was actually one of the first people to study talk aloud problem solving. He had this model by which you would talk aloud problem solve situations, and then you would slowly make it less and less vocal, sub-vocalization. So it would start out with the correspondence training, it would go to problem solving, and so you were moving from compliance to tracking. So the idea was to move the person from compliance to command to tracking the occurrence of general rules. And this was laid out even in Russell Barkley's book on self-control, which is in the 90s. And you can see that model laid out there. And it was actually debated by behavior analysts. David Reitman did an excellent he had written one of the first things on the development of rural government behavior, but then kind of swayed away from that. And so in the early 2000s, he had written an article uh, on why it might not be a good thing to go into this model of rural government behavior and just stay focused on contingencies, which was actually a pretty decent paper. And there were counter papers. He was writing counter paper to, I think it was Leisha Barry's paper at the time, but I can't remember. That was some years
Well,
ago.
Joe, I mean, the things like ADHD and schizophrenia, a lot of the people conceptualize them as a chemical imbalance or lack of a chemical balance in the brain or some kind of neurological problem. Like the major mental illnesses are really just neurological problems that we don't understand well that yet. Is that,
Well,
I mean, how do you respond to that idea?
well, I tell people it's a person that exists in a context. People are biopsychosocial beings.
Uh huh.
And just because something is biological doesn't mean you can't treat it behaviorally. And we've done that for autism,
Uh-huh.
which probably has a strong biological component to it. We've done that for schizophrenia, which has a biological component to it. Now, I used to teach a course in developmental psychopathology, behavior analysis, and child development and behavior analysis and developmental psychopathology, where I looked at behavioral models of how these syndromes develop.
Hmm.
But even if you go back to the early conduct disorder model, right, where you're talking about, and I could talk a little bit about that in a minute if you like, but you could talk about the initial work by Herb Quay and some of the people was that from a very young age, children were showing a hypo-responsiveness to punishment.
Hmm.
And they were more likely to develop what we would come to see as oppositional defiant disorder and conduct disorder. Now, early on, Patterson and Conger kind of showed that. So he basically argued that it was um, a biologically set basis. They're less responsive to punishment, so the parents have to use more punishment. The punishment gets kind of chaotic, and that's how you wind up with a conduct disorder kid. Patterson, on the other hand, showed that if the early learning environment is sort of erratic, then the child becomes less sensitive to contingencies in general, not just punishment,
Yeah.
the reinforcement reward.
Uh-huh.
And this was Patterson and Conger's paper. Um, and they were able to show this was very early that you can actually produce a similar effect by lack of contingency detection from the child by making it less clear how the contingencies are going to occur. So this, and I think he talks a little bit about it. Patterson, unfortunately, has passed many years ago, a couple years ago, and he was a phenomenal. He was you always referred to himself as a social interactionist. He used a lot of behavioral. I mean, he started out as a behaviorist, and he moved to social interactionism because he took the reward and punishment principles and took them as more live action between people. But if you look in his last book that he did for APA, which I think everybody should read, which is a phenomenal of how this research can be done. Uh, he did a book with James Snyder, and it's on APA Press on development of conduct disorder, and it's kind of an edited volume. But some of the chapters in that book are really phenomenal. So anyway, so you get that as the social learning, social interactionist behaviors perspective on the development of conduct disorder. But even if you were to buy that something starts out as biological,
Uh-huh.
does not mean you can't fix it.
Uh-huh.
Does not mean people cannot rewrite their software to accommodate. Their software that they have in their head can be changed and modified to fit the faulty hardware,
Yeah, you
right?
cut out just
So
a
I think,
second. Joe,
go
you
ahead.
cut out just a second. So just because something is biological does not mean you can't use behavioral interventions to great effect, in other words.
Right. Right. So the idea here is that there's probably biological stuff in a lot of things. Even language probably has some kind of, we speak, for example, even Skinner acknowledged that we speak when we talk about verbal behavior. It starts out the idea we speak, but you get remnants of it in chimpanzees, but you don't get a pig speaking, right? You get sign language, like Niemczycki got sign language, and Kanzi got sign language real well. But you don't. You can get those kinds of processes, but you don't get anything that looks like human language. We build cities, for example.
Uh-huh.
You don't see that in many of the animal species. So you've got to say there's some biological credence to some of these things.
Uh-huh.
But is it all biology? And I go back to Japan pre and post World War II, and I give the example is before World War II, uh, the average Japanese citizen height was 4 inches shorter than post World War II.
Mm-hmm.
Now, obviously, we did not get a genetic mutation in those 3 years of World War II. What happened was post World War II was you had a flood of protein in the Japan. And so what happened was from the flood of protein, so height's all biological until you get one factor that shows you that you have a lot of environmental room to play with. With conduct disorder, we found out Gottlieb did studies, and I can't remember the actual study, but he found that shared family environment. He was looking at twins raised apart, and twins raised together versus just twins separated at birth, and non-twins, non-identical twins. And what he found out is shared family environment was the biggest predictor of the development of conduct disorder. 90% of the kids that were truly rated as conduct disorder. And there's been a lot of variables on that. If you even go back to the 60s, the forgotten literature there is the monitoring of children. You see the kids who grow up in the free-for-all where they have no parental monitoring, they have no contingencies put in place, much more likely to develop problems with the legal system and the law. So there's stuff that goes all the way back to then. You can see studies from the 40s and the 50s found that out. So just because something comes up with a biological variable does not mean it's all biological. If anything, you have a person that interacts with a context over time, and that produces the results that you get either as psychopathology or developmental psychopathology, or as improvement, or whatever along the line. And that's something very powerful to kind of think about.
You had in the ABAI conference in 2015, apparently you had a discussion about the correctional system and behaviorism. What can you tell us about that?
Well, I was a correctional psychologist for about a year and a half. This was 2009 to like 2011. I was a correctional psychologist. And a lot of people don't realize this, but there's behavior analysis really goes through its periods. Sometimes it got run out of fields because of its abusiveness, and it wasn't such a good idea. Like in corrections, I think one of the killer things was the salicylate treatments that were done by psychiatrists. They weren't done by behavior analysts. They would inject you when you did something bad with this drug that made you feel like you were suffocating for 10 minutes. Right?
Really?
And so, yeah. And so this led to and I think Gold Diamond talked a lot about this. Do we want to be a purely eliminative approach, or do we want to be a constructivist approach? And in other words, do we want to build skills, or do we want to be something just to suppress behavior? And a lot of the behavior analytics stuff that was done at that time was actually being just used in a purely eliminative fashion. Now, there's a point for purely eliminative programs. I'll get to that in a minute. I can tell you that in purely eliminative programs, you do get rid of some behavior problems that, if you don't get rid of them, could be a real problem in prisons. But the two big, and I ran a journal for a while that we sold to APA, which was behavior analysis in correctional environments. behavior analysis and corrections. We sold that over to APA when we sold all the ABA journals to APA. Now they're all housed under one title, two titles: behavioral development, and the other journal is behavior analysis, research, and practice. They're both APA journals. So you could always kind of publish there, but those journals are 20 years old now. But anyway, going back to corrections, as I told you, I taught in a criminal justice department. There was a long history of behavior analysis and corrections. And the meta-analysis, there were two really important meta-analytic studies. Now, these meta-analysis studies, you shouldn't just take them completely for behavioral, but I can actually send you the link. I have actually on my computer, I have, hold on, I'll pull that up. And then if I could come over here and in the chat, I'll send you. This is Grant and Gordou's study. If I could get it to paste in.
Joe, I think WebEx might cut us off here in a couple minutes, but I sent a link to see if you got it, a link for another meeting to start immediately afterwards.
Okay.
You see if it showed up. We'll see what WebEx does, but I'll let you keep talking.
Okay. So WebEx might cut me off in a few minutes, and I could get winded. Everyone who has ever had a class with me will tell you that. But there were two big studies. One showed that behavioral programs based on either behaviorism, radical behaviorism, social learning, or CBT. That was what they defined it as, versus non-behavioral have, and that's the Psychology in Spain meta-analysis I showed you, have a much larger effect size than non-behavioral programs in preventing recidivism. And then on the other one, it's on prison misconducts. They looked at the same behavioral versus non-behavioral, and they looked at cognitive behavioral, radical behavioral, social learning as the behavioral end. So they're not purely behavior analysis, but they're good starting points for us. And they found out that they had the largest effect size in reducing prison misconduct. So the idea here is, and I posted those two links up for you. I just happen to have them on my computer. So I just sent them both to you. But the idea here is, and these are early 2000s, is behavior analysis has made a large contribution to corrections and prison management systems. Now, initially, the push became that a lot of the things behavior analysts were doing, such as the person would earn reading material, were proven to be things that the Supreme Court would rule were unethical. That they were illegal. You cannot deprive a prisoner of his right to read, so you can't hold his reading material to let him earn it back. Do you get what I'm saying? Mm-hmm. So a lot of that stuff got flattened there. And so, it took more creativity. When I was in prisons, we were allowed to, for example, use coffee as a motivator, but they didn't want us using coffee with caffeine in it, right?
Yeah, and so those kind of institutions, you run into the practicalities of the setting you're in, which is what I found in the state hospital. There's just some realities about how things are done, and human rights and all kinds of things that don't allow you to make the behavioral program that you would necessarily want to.
Right. So, but again, and I think some of it, this was questions early on. And if I got to find that reference. There was a reference where there was actually a series of congressional hearings. This was in the 70s, that were done on behavior modification, what was called behavior modification back then, less use of functional analysis, more use of punishment procedures. And these, unfortunately, what happened from these is it set off a bad current into the system. But even in prison, that was one thing that damaged behavior analysis in prison. But when I was working with my friend Kirk Neuerger on the journal, and we were both lead editors of the journal, we were finding other studies that still were getting done. Um, we were finding other studies that were still being done, and that we were trying to get people to publish with us. Now, there are things such as functional analytic psychotherapy, which is a radical behavioral approach to the therapeutic alliance, and working on intimacy behaviors that are very, very important. Behaviorism, by the way, really did survive more respondent conditioning procedures, but some operant conditioning procedures like Joe Costello, no relation, although sometimes I got mistaken for him when I was young. Um, yeah,
You were
he did some work.
You were mistaken for whom?
Joe Cotella.
Oh, okay.
Cotella, he was president of ABT, so I thought it was a great honor when I walked up to the thing and I asked, I'm Joe Catelli, I'm here for my stuff, and they handed me Joseph Catella's stuff. I says, I don't think he would be happy for it. And other people used to say when I was young that I looked a little like Joe Scotty, who was a behaviorist at the schizophrenics. So, because I think it was dark beard and stuff.
Okay.
So between the two, I used to get confused. The people used to get confused with me all the time. But it was kind of like funny because those guys obviously wonderful careers to go emulate. But Joseph Cotella, and he did a book. Used to do contemporary issues in behavior therapy. Well, there was an article he did with Ashwick where he talked about a radical behavioral interpretation of empathy and built an empathy training model for behavioral interventions with people who were perpetrators of things like sex offenders and stuff. And you'll see that there was, and there still is, a very strong behavioral opponent, Gene Abrams.